Hi, good morning, everyone. It's actually good afternoon from Geneva, and hello and greetings, whatever time zone you all are. Welcome, everyone, to the Young Women Leaders panel, which is being organized by World YWCA. And this is our second of the series. We are hosting one every month on a different topic. And this is an opportunity for us to engage with young women, young leaders from different countries, different regions, every time a different topic. So I welcome everyone to this amazing panel. And this particular second panel is very special to us. We are, as you can see on our social media, the World YWCA is running a campaign right now called My Body, My Mind. And it is linked to sexual and reproductive health rights and mental health. It's a 2-week long campaign which is being run by young women, and you will see a number of activities on all our social media. This particular panel is one of the activity of the campaign. What we are looking at today is specifically issues of COVID-19 and what has been the impact on sexual and reproductive health rights and mental health. I want to start a little bit by introducing our panelists. I welcome all our panelists today here. Thank you so much for joining us from all the corners, from different time zones, and coming together to share your wisdom, to share your experiences and expertise with so many of us. Let me introduce each of them. We have with us Dr. Shakira Chunara, who is an independent public health practitioner and the 2017 Women of the Year in Health in South Africa. She's a rising global icon. She's an award-winning researcher. She's a bold activist, and she has been with us. We have known her from last year, and we are so excited to have her here today. She's her work in South Africa is well known. We also have with us Dr. Patricia, who is the General Secretary of YWCA of Scotland. She is a young feminist, a mother, a doctorate of Vikings archaeology. She's also a self-confessed dog-loving vegan. And she moved to Scotland from Poland 14 years ago, and she has pursued her studies in Aberdeen and Cambridge. And she has her research on archaeological research focused on Viking Age women. And we are so excited to have her here. We have been trying to chase her for a long time. Also have with us, thank you. We also have with us Ronnie Shakya, who is amazing young woman leader from Nepal, who has extensive experience of working in communities with organizations like YWCA of Nepal and Mary Stopes and many other organizations. She's a young woman who is currently pursuing her master's degree, and she has immense firsthand experience of working on reproductive rights issues and mental health issues in the country with the young population, youth firsthand, and you'll hear more from her. I am, as I mentioned earlier, I'm the lead for global engagement and strategic communications at the World Office, and I joined the World Office 2 years back. I'm a feminist, a mother to a 15-month-old baby girl, and I'm raising a feminist, and that's another side of us. And and I'm happy to moderate this panel with all of you guys today. uh, I wanted to just before we start the panel, I wanted to take this time to invite Casey Harden, our General Secretary. Can you unmute her so that she can share a few words with us?
Hi, can you hear me, Danny and Suchi?
Yes, we can hear you, Casey. And
fantastic. Hi, welcome everyone. Thanks for giving me just a minute to say a warm hello to everyone that's on this part of our 2-week-long campaign for SRHR and mental health, and also for the second round of this series of listening, raising the profile of and listening to female leaders. So just quickly, goal 2035 for World YWCA, that's our goal that we have an eye on, and everything is really in pursuit of a vision of millions of young women transforming power structures to a more just and equitable world. And that goal 2035 is as especially pertinent during this pandemic, where we see a disproportionate impact on girls and women. And we see that same disproportion, which is commensurate and reflected in the lives of girls and women that are already most impacted by the ill effects of oppressive, patriarchal, and unjust systems and social norms. And part of that is obviously our sexual and reproductive rights and our mental health, and we must tend to those issues. So I'll be listening really closely today to Shakira, Patricia, and Ronnie, the leaders on the panel, and I welcome and encourage you to do the same. And thanks, Suchi, for moderating what I'm sure is going to be a brilliant discussion. Again, welcome and thanks for joining us on our common vision.
Thank you, Casey. Thank you so much for sharing that. I'm pretty sure everyone is very excited to hear from these brilliant young people. So the idea this time is to have a panel which is more of experience sharing rather than hearing a lot of theoretical content and contexts. We have planned some interesting activities during the panel and by the end of the panel, but what we thought was it will be very interesting for us to start with a poem. And I have a poem which is a page from my torn pages from my sexual harassment diary, something I wrote back in 2015. And I reflect on it and I read it very often. It's a poem which is very close to my heart. So I thought we can start with that and then go on and start discussing the theme. And I think the poem will also set its way for the theme. So what did they do to me? They did make me lose a little faith in men, in society. But here I am, healing myself, sharing clouds above my head or shadows from the past. These are all memories, all so vast. I sit here, so choked, and you say I get emotional about patriarchy. I look at myself in the mirror, a piece of art am I to all, or a human who lives emotions, waiting for the invisible veil to fall. And you say I'm breaking the foundations. Hollow, aren't they? They look around with dirty eyes, waiting for them to catch her. Faith seems to diminish as I see another woman getting tortured by a man. And you say I'm too much of a feminist. The pain of one and every woman who looks around with eyes wide open every single time to save herself from any trouble, to run away from those stripping eyes, to fight back those violating hands. Is she alone? Am I alone? I say to these predators, these acts of violence don't make you strong. You are so weak, so, so weak, because you're scared of a woman's sexuality. This is my body, my mind. With that, I really want to start the panel. I'm hoping we will have Shakira in soon. Uh, um, I think let us try to see if she is available. Yeah, I think she was having a little bit of internet issue. Nevertheless, I wanted to uh, thank everyone for joining the panel. Yeah, I think the poem made me a little emotional because it reminded me of a lot of incidents. So let's start by asking Patricia, maybe we can start with you. How are you feeling, with what all that's happening around the world and in your region, in your community, in Scotland per se? How do you think this pandemic is affecting you?
Yeah. Well, as I was saying, like before everyone join us for this panel, I feel really tired. I think we all feel really tired. It's been going on for so long, and kind of the stress and the anxiety that comes with the lockdown and just state of the world in general. It kind of feels that anytime that you switch on the news, there's another horrible thing happening, and it feels like 2020 just keeps on giving those horrible news. And And you get to the point when you feel like, oh, it cannot be any worse, and then the next day you wake up and you're like, whoa, actually it can be way worse. So I think I think it's really tiring. And I also feel like, because we started living our lives just online, we don't have our usual kind of escape routes. Before, if I felt overwhelmed by the state of the world, I would maybe do a little bit of digital detox. I wouldn't be checking social media for a couple of days, or I maybe wouldn't be reading news every day, just to get into that kind of positive activist headspace, and not feel burned out. But now it kind of feels it's impossible, because that's how you connect with people. That's how you connect with your families. That's how we do all of our work. Everything is happening digitally. So it kind of doesn't feel possible any longer to switch off. And I think, and I think it's tiring. I think it's tiring for all of us. Having said that, I feel like I have a lot of privilege. I have my own home. I live with a very supportive partner. I have a lovely daughter who doesn't sleep a lot, but hey, that's babies for you. I have a job that I love. I have a team that is extremely supportive and who managed to adapt to these changes really quickly. I'm able-bodied, white cis woman. Like, that comes with a lot of privilege. But it's still tiring. So I cannot imagine how it must feel for people who just don't have that privilege. In those current times, it must be exhausting.
Yeah, I mean, what you just said is so true, that we are always reminded of the privileges we are carrying, and not all of us. And we are very conscious at World YWCA of that fact, and I'm so glad that you know that, and like all great leaders, we have to reflect on it very often. Ronnie, how are you feeling? Ronnie joins us from Nepal.
Thank you, ma'am, for your questions. Well, first, I want to introduce myself. Hello and namaste. It's me, Roni Sake. Nice to meet you all. First of all, I would like to thank World YWCA for hosting online panel discussion in the midst of pandemic situation, and I'm truly honored to share my experience and my thought in this platform. And today I feel so happy and glad to be a panelist from Nepal. Well, I'm a bit nervous because it's my first time. So it is been more than 3 months of lockdown. The communities and people are traumatized, depressed, and frustrated with all the happenings. And I keep on hearing the news of death and sickness and a lots of issue. Being a leaders and being an activist, I feel helpless sometimes, as I cannot be everywhere and help the community. I miss my working in field, being physically present to helping the needy people. And nowadays, calls and texts have been our means of communications, and it has affected in many ways. Thank you.
Thank you, Ronnie. I mean, that's another side. All of us are facing different issues, and the 3 months lockdown period, I can't imagine how that will be feeling like. I kind of can, coming from India, but I hear the stories. And thank you, Ronnie, for sharing what's happening on ground. We have with us Shakira. Shakira is finally online. We got to know that she dropped off because of internet issues, but Shakira is back. Shakira, we how are you feeling with the lockdown, with the situation around COVID? It's been a long time now, and in many countries things are getting back to normalcy, but that's not the reality of the global world, and we're still facing a fear, and we're living with fear. How are you feeling?
So, I mean, a huge hi to everyone, and I'm glad I'm back, 1,000% back, of course. Sushi, I missed a little bit of what Roni was saying in Nepal, but we've also been 3 months into lockdown in South Africa. And just 2 days ago, we reached 100,000 positive cases. So I feel a lot of fear at the moment because I know the system weaknesses that we have in healthcare. I know there's a growing burden, and also the sense of, I think that there are blue collar workers who are immediately impacted by the lockdown. And then I think at some point, each and every one of us is going to be affected. there are times I feel like, why am I even doing this work and going on as if life is normal? Is life ever going to be normal again? So in some, it's really a mix of emotions, and it's hard to describe, I suppose, but hanging in there.
Yeah, we're all hanging in there. Thank you, Shakira. That was candid. And I mean, I keep on talking to a lot of activists and leaders and young women right now, and everyone is feeling the trauma because they know the realities of the how broken the systems are in their countries. So I can very well relate to all three of you, and we very well understand, especially with issues around sexual reproductive health rights and mental health, which are shooting up right now. And my question to all of you, and maybe we can start with Shakira this time. My question to you is, what do you think how is the situation around SRHR and mental health in your region, and what do you think are women experiencing? What is happening during the lockdown? How are those issues affected?
Mhm. So I think, there's different ways to unpack this, and I don't speak for the entire region, but I speak of some of the experiences I hear of or some of the work I'm involved in. There was actually a patient who went in for mental health care to a clinic or a hospital, and they were turned away to say that a mental health issue is not as important as COVID-19 or cancer. So this is someone who's going through an immense depression, needs the medical help, but our system, in fact, the private healthcare system, could not even tend to this woman. So that's on the one hand. On the other hand, reflecting a little bit on my own experiences, but I suppose everyone else as well. We're telling people, your mental health is important, and switch off and keep active and all of that. But at the same time, I had a bit of a laugh when I saw some emails where they say, we hope you're well during this time, blah, blah, blah. And then the bottom goes to, where's your deadline? Where's your work? We're waiting for you. So we're giving people conflicting advice. We're saying on the one hand, look after yourself, take it easy. On the other hand, where the hell is the work? And also, there's this expectation suddenly with the whole virtual world that we should be available all the time. So that's bringing it closer to home. And I'll quickly end off by saying that in South Africa, at least, and South Africa is a bit more well off compared to the rest of the continent. But in South Africa, at least, what has happened is there's been an entire focus of the system on COVID-19. Obviously, it's an emergency, but people with chronic conditions are suffering. It's difficult to go and report GBV because of the lockdown. We saw a massive surge in GBV cases. And then finally, I'll end off that even women who need contraception, young women, their services are disrupted. So, in a nutshell, that's where I would go with this.
Yeah. Ronnie, share your insights on this.
Okay. As I said earlier, it has been more than 3 months of lockdown. In this lockdown, we all are affected directly or indirectly, especially the young girls when they are having their periods. They cannot go outside and they cannot buy sanitary pad easily in this lockdown. In Nepal, suicide, rape, and abuse case is increasing day by day, and unsafe abortion is increasing, and domestic violence are increasing, and a lack of accessibility of contraceptions and family planning, and lack of mental health treatment, etc. And although the government of Nepal distribute of relief packages and quarantine, neglecting others services like safe motherhood services, family plannings, contraceptions, and counselings, and menstrual health management services. Uh, uh, it's also important. Uh, uh, it's also important. um um, which are equally important, relief packages including food, only food. There is no including sanitary pads, their quarantine are not friendly. So women and young women like me are demanding the quarantine friendly, gender friendly quarantine, and including sanitary pads in the relief packages, along with others NGO, INGO, and different groups of clubs. Youth are more active nowadays. I have distributed some sanitary pads and some food packages for young women in my communities, and conducting webinar related on sexual and reproductive health and right with local government and municipality, and sanitizer and masks distributed for young women in my communities, and uh, participate on local level, allocate budget allocate webinar as a young woman. uh, Now I am a part of a group in social media that provide online counseling for young people, because in this time young people have a frustrated tension, so that we are giving safe space for young people, and we are listening their voice, and if needed we are providing counseling as well. And I think even listening to people during this lockdown period is very helpful for their mental health.
Yeah. What two things that you which you said were very critical and they stuck by me. One is the gender friendly quarantine packages. I mean, not all countries, not all governments, not all local systems are thinking about it, which is a reflection of the fact that when we think about a crisis, we don't think the gender dimension of it, which is what we are still fighting that battle. And the other part is of mental health issues of young people, which you spoke about. This is this the quarantine and the period of isolation and the difficulty with the pandemic has reflected how much mental health is a problem for young people, especially because they are stranded in homes sometimes with their violators. So thank you, Ronnie. Those were like real field reports that you shared and very insightful. Patricia, we come back to you. I mean, Scotland is a completely different ball game, but yet there's so much similarity. What do you think about how SRHR is being affected?
Yeah, absolutely. So I feel like in the areas where we have kind of gender inequality, there are like those critical cracks that have expanded hugely since the crisis started, just showing us how shaky the foundation really was. Even though we were, we felt like we were sort of progressing towards the gender equal society, like those things that seem like small cracks, they've been expanded since this crisis started. So, for example, we've seen so all of our schools are closed, children are homeschooled, and there is research showing that 70% of mothers are responsible for homeschooling on top of homeworking. So the pressure of kind of having to essentially work two full-time jobs, often with multiple children, and doing all the kind of caring responsibilities and housework and cleaning and things like that. And we don't know when schools are going to reopen, potentially in August if everything goes well, but it could be just on a part-time basis. So people, women will have to then navigate, working full-time while homeschooling their children part-time. Another thing that we've seen a huge increase in, and I think it's probably across the board, and it's not only specific to Scotland or the UK, is of course increase in instances of domestic abuse, with women being stuck at home, with perpetrators of violence and not being able to access kind of physical safe spaces. And we've seen like a huge increase in the visits to websites of domestic abuse charities, people kind of trying to arrange times for a phone call when it's safe for them to speak about those instances. But obviously, if you live with a perpetrator of violence, you may not have access to a smartphone, you may not have access to a laptop, there may not be any time during the day when you are able to make that phone call safely. So people are stuck in those really dangerous situations. Another thing is obviously stress levels. They are through the roof for many reasons. Some of that is sort of those pressures around having to, wear so many hats and juggle so many responsibilities, living in unsafe conditions, kind of worrying about economic crisis. We know from previous economic global crises that young women are usually affected the most because they tend to be in less secure employment situations with the gig economy and doing freelancing and working 0 hours contracts and not having and working in sectors that will be hugely affected, like care sector, for example, or entertainment sector or a hospitality sector. So there is a lot of fear around that. And finally, we've seen kind of increase and reports around mental health declining in lockdown. And there are some figures like being slowly released by universities in the UK who are conducting research around that. So for example, Institute for Economic and Social Research at the University of Essex found out that 27% of women have reported experiencing mental health problems during the pandemic, compared to 11% before the pandemic. So we are looking at kind of those figures doubling, and they are probably even higher realistically. So yeah, so there's a lot of things that contributes to that, to mental health, to low mental health during the lockdown, and kind of lack of access of appropriate support services to support women and young women when they are going through those really challenging times.
Thank you, Patricia. I mean, one point you mentioned about digital diversity. I mean, the fact that digital divide, digital literacy, digital gap is so huge. And with the quarantine, while we have gone more digital, for women, access to digital tools is so debatable because it's not that it has gone up. You are now in a space where you might not, even if you have an access, you might not able to use it. So that point really sticks by, like, in my mind when I think about it, because the mental health around that complexity, that one is you don't have access, another is, oh, you have access but you can't use it. So that point around digital diversity is so strong for women, that it sticks by. I mean, I go back to you, Patricia, again, and I ask you a question around what do you think, I mean, with respect to how the COVID crisis has been managed in your community and in your region, uh, and for example, for women's access to health medical facilities, things like these have gone down. What do you think is key to advocating these challenges? Like, as a activist, as a in the space you work in, what do you think as how should we be advocating about these challenges, and how do we work around them when we look at it from now to a post-pandemic world?
Yeah. So yeah, that's a huge question. So in terms of just like giving some kind of context for the situation in Scotland in terms of access to services. So we've had some services restricted or kind of stopping entirely, and a lot of services moving to over the phone and online support, which, as you mentioned when you were kind of making your comments, this leaves out a lot of women who really rely on that physical outreach. So for example, in Scotland, we have a huge population that lives in remote and rural location where access to internet is limited, or it's really poor. You have really poor phone reception, so you're not really able to access those services. And as you mentioned, like people who are not really literally digitally literate. And I think we've only realized in this pandemic that this is also a huge population. We all assume that everyone knows how to navigate online world, but that's not the case. And also things like, some methods of contraception being difficult to access. So for example, those kind of long-term methods of contraception like coil or implants, it's nearly impossible to access them right now. So you're basically told to use condoms or the pill, and that might not be appropriate for you. And period poverty is a huge issue. Scotland is kind of making waves. We've, just before the pandemic started, just before the lockdown started, the Scottish Parliament voted on a bill for free provision of sanitary products across the board. and we're in stage 1 of that process, and it's only when it goes through stage 2 it will be adopted in the Scottish law. But we don't know when that's going to happen because the Scottish Parliament is currently closed, and all the kind of non-essential business is pushed to a later period. But yeah, there is definitely kind of evidence of people not being able to access sanitary products because they relied on charities that are now closed, or food banks that are now closed. Some of the food banks are open, but you need to use public transport to be able to access them. And we've been like posting packages of sanitary products to people directly as a way of kind of making sure that they still have access to that. Having said that, we've also seen some positive changes. So for example, medical abortion in the UK, where you get like 2 pills that you take for abortion. In Scotland, you can take both of these at home, but in England, you would always have to take the first pill in an abortion clinic, and that has been changed for the time of the lockdown. So people can now at least access those kind of services from home. So I think what needs to change kind of post-pandemic is kind of taking those learnings on how we can adapt services, definitely kind of increase in digital literacy. If we want people to be able to access services digitally or over the phone, we need to make sure that people actually have access. And either very cheaply or free access to internet and smartphones and kind of other digital devices that we can use that way. And I think doing things online, it actually makes things way more accessible for many people when they're like juggling a lot of things. So I think there needs to be focus on that. But to be able to do that, we need to make sure that everyone has access and everyone knows how to use that technology and everyone feels comfortable doing that. So I think that should be a kind of a huge learning from this pandemic, that moving everything to digital is just not going to solve those issues. If we are leaving women who are most marginalized anyway, women on kind of poor income, women who really rely on that support, homeless women, for example. I mean, you're not going to, have access to Wi-Fi and a smartphone. So if you don't have that physical outreach, you're just not getting any support whatsoever. And I think that's something that we really need to concentrate on, kind of moving forward.
Yeah, very, very valid points around there. I mean, great example there. When Ronnie shared her perspective of how unsafe abortions have become, and then you're sharing. I mean, it's so country-wise divided. And there's the population size different. There's a whole approach that governments are following, which are different. I'm intrigued to listen to Shakira on the same question. Shakira, what do you think are, I mean, in the post-pandemic world, how do we deal with, and what should be the priority when we are managing and advocating for these issues?
So sorry, everyone's going to see me reaching out and on as I try and get in with my mobile phone. But I think, for me, a key issue in being in public health is that our health systems are weak. And last year, it was good to see a call for universal health coverage. But what we saw with the Ebola situation, for example, everybody spoke about strengthening healthcare systems. What really happened since 2015? We're now in 2020, we're sitting with COVID-19, and we're still asking the question about strengthening our healthcare systems. So for me, I think the answer really lies for us in this post-pandemic period of truly having health systems which serve women and girls. That will be the one. The second thing is, how do we strengthen our NGOs? Because I think our NGOs and civil society play such a critical role in women's health and girls' health. And what's happening at the moment is we see many NGOs facing funding cuts, uncertainty, and what is this going to mean for the post-COVID-19 world? So I think that's the second thing. The third thing we definitely need to consider, and I really like that Patricia touched on it, was the digital divide. And so what we're going to see is that women are probably going to be even further excluded. Already we're seeing young children who don't have access to technology, not being able to migrate online. So what are those impacts? So I think the already excluded are going to be even more excluded. And what is our real action going to be on that? So, I mean, I think those would be my top 3 items.
Yeah, very strong point around there with the funding aspect, and we all are reading right now how funding is getting directed towards the immediate needs, and in a post-pandemic world, maybe how we need to even relook at funding. That's something that I we actively discuss, that how do we relook at funding. And I've been at so many panels recently where that discussion is happening. So I'm glad that that discussion is happening, but I don't know how actively it's happening with the governments and with the people. The civil society is discussing it, like they actively discussing it. So very strong points there, and especially touching upon Ebola. I look at it, and specifically from African perspective, you look at that, and then you see COVID happening, and then you know that we all know pandemics are going to come. Like, this is not just the one. So how do you ensure that systems are conducive enough? Very valid points from both of you. I now go to Ronnie, and Ronnie, from you, I'm keen to listen about. I mean, how do you think can we work better as activists, as NGO sector, as international NGOs, as community-based organizations, to support the young population, to support, and how can we partner with them? How can we partner with young people? And at World, I mean, World YWCA and YWCA movement per se is a young women-driven movement, and we like I said initially, the campaign is being run by women, but on ground, what is your suggestion to other and to many other organizations on how do we partner better with young people? You're on mute, Ronnie, you're on mute.
First of all, we should be engaging more young people and conducting more sessions related on SRHR, and collaboration with local government and many NGOs, and conducting more webinar sessions with local levels and ground levels and young peoples. That's it.
Concise and clean. I mean, I agree. And to link it back to what Patricia and Shakira was saying, with the challenges that are there with digital divide, there is a very big opportunity to utilize that digital sphere right now when you are actually not meeting anybody. So using that for skill development, for technology, for skill development, and looking at it from an access point of view, both together. So I'm glad that they sink in from all three of you. I am mindful that we have some time, and I'm glad about that. One last question, which I'm going to go to everyone, and then we move to the next part of the webinar, is one word. I really look forward to one word from each of you, which can be a change maker for the post-pandemic world. Just one word. You can elaborate on it, but I need a word. So, Patricia, do you want to start?
I'm going to cheat. So mine is gendered data, and I would use it with a hyphen. So it's one word still, but it's really two. But yeah, I think that we need better data on how this current crisis, but how inequality in general affects women specifically and different groups of women. I think there is a huge gap in data, and enable to have responses that are appropriate. We need to have that data, we need to have women's stories, and we need to kind of apply that intersectional lens and make sure that support is appropriate for everyone. So yeah, gender data as my one kind of two words answer to that.
Thank you, Patricia. Shakira, your one word.
So I'm totally going to cheat. I'm going to make it a hashtag so it becomes one word. And I'd say hashtag real change, because I'm feeling a little bit frustrated in the development space at what I see. And ideally, after the post-pandemic world, how do we really shift things?
That's interesting approach. Both of you have introduced interesting approach to one word. Ronnie, what do you say? What is the one word? Mute. You're on mute, Ronnie.
Okay, one word that can be changed maker for me is engagement, because in this pandemic we have seen how young people are getting engaged with community work, and when we are engaged the young people, they bring cool ideas and innovative concept to deal with the situation. That's why I think engagement is the one word that can be change maker.
Thank you, Ronnie. I mean, I'm gonna cheat here. I'm also going to give this answer myself because I really, really feel it's important for us to have hope and look at great stuff that we can do. And I'm so intrigued by the three words that you guys shared: gender, data, engagement, and real change. My word is community, and I feel that's linked to all three. And I feel that it's time we really look at communities. We really look at ensuring that the leadership and the power and the dynamics of change, of real change, come from community rather than top down. And we have discussed this a lot. We have been discussing for globally forever that it's about time that communities have that's where the real change happens. So engagement and real change come together to bring gender data helps us in that, and I feel communities is so central to it. So I'm trying to weave in a story here, and I'm so glad about that. We have some time. What we have right now is a very interesting part of the panel before we open for Q&A. I shared with the panelists that like I recited a poem. What are they interested in doing? And we got some things from Ronnie. Ronnie, there's a video Ronnie has shared which she wants to share with the group today. So we can maybe start playing that video first. If my team can play the video. Thank you, Ronnie. I mean, to look at what SRHR work on field means and how much you've done, and this is so beautiful to just. It's also a reminder for all of us who are not on field right now that there's so much that needs to be done now that we are not on field. So, thank you, Ronnie, for sharing your journey. Patricia has shared with us a very interesting poem by, and I'll let Patricia talk more about it.
Yeah, sure. So it's a poem kind of challenging period stigma and taboos around periods that was written and performed by a young woman who is alumna of our leadership program called Young Women Leads. And she is also now on our advisory panel, kind of advises me on everything that the organization does strategically. And her name is Diane Stewart, and the poem is called Period.
Okay, I'll try to play the. I'll try to share my screen and see if the video plays in. Okay, share. Please let me know if the audio is playing or not. No? Can you guys hear the audio? No? Oh, okay. That's a bummer. It's a little strange. We were playing it yesterday. It was playing. Okay. Stop sharing. Sorry. So, just a second.
So
Okay.
you want me to try?
Yeah, if you can try, maybe. Yeah.
Okay, let's see here. Oh no, I would have to restart to be able.
Okay.
Let me just give it a go and see if you guys can hear it, but I'm not
Okay.
sure this is gonna work.
Period. If I was an American,
Can.
that's what I'd call a full stop,
Yeah.
which is funny because that's what I used to draw my calendar so I could track when the next one was expected. I now have an app for that. Really, it would make more sense to use a comma. Periods aren't a stop in what you can do or how to live your life. Just a little break or a moment to think, a pause, not an end. Now, I'm sure I'm not the only person who's wanted it to end and never start again. But I'm lucky that way. I've never had to put my life on hold because of my period. I've managed to continue to ride my bike, go for a run, have a swim. I'm lucky because I've had enough money to buy products, which means I can continue on with my life. Although it doesn't mean I haven't resented the tax. I'm lucky because I don't need to dread the day when my period comes, when the calendar dots or the app notifications tell me I need to be ready, because I've always been able to be ready. I can be grateful that my body is fairly healthy and doing what it does. I don't need to worry about what I'm going to miss or what I'm not going to learn, what exam might be too long or what clothes I need to wear. If my period hangs around for an extra day or comes at the wrong point in my payslip. Imagine if that could change. Imagine if there was a better way of doing things. How great that would be. It could change lives. You'll find that if you want to talk to me about my preferred methods of sanitary products, I can't shut up. It's becoming a bit of a thing. I'm not going to say I love my period. Truth is, we don't always get on. But I'm not going to hide our relationship either. We've still got a long time together.
Thank you, Patricia. We will share the video because we were unable to see the video. We'll share the video on our social media today so that everyone can have a look. And maybe in the chat pod also, Patricia, if you can share the link on the chat pod for people to have a look. We move on to Shakira, who's I'm in surprise. I want to know what she's going to share.
Well, I think I missed that part, but I could always break into a song like Waka Waka, and that will take off. Jokes aside, I penned a piece, and this year has been really great to get in touch with my creative side. Because I think sometimes as activists we go down such a serious path that we miss the creative parts of our life. And so I penned a piece very early in the pandemic, a little poem, and I called it, at that point, South Africa had just gone into lockdown and massive amounts of people had lost their jobs. So it's been the wave of times, unsettled, unimaginable. Capitalism cracked, dented. Some prophets saw. It is not seen, but in sickness, in death, Invisible it is, forget not. Real screams, devastation, new ways, our hope.
Thank you, Shakira. That was touch. New ways is our hope. I mean, we look at. I'm just looking at all the amazing stuff and information and knowledge that you guys have shared today, and in new ways is definitely our hope. So that's a beautiful way to maybe come to the final points of the panel. We will be sharing the panel's recording on our social media, but we are going to now open question and answers. And there is so I'm gonna read out the question, and maybe people can you guys can pick and choose who wants to answer it. The first question we have is, when you talk about redirecting funding, how do you propose that this is done from a community development and activist standpoint? uh, Anyone wants to answer that?
I
Shakira, you
guess,
want to get? Yeah, go ahead.
yeah, I'd like to give it a first stab, right? Because this question came to me as we were seeing so many pledges and so many governments calling for money, and a lot of money is now being poured into COVID-19. But the transparency around that worries me. So I think in the post-pandemic world, before we even start about resource allocation and everything else, I think we need to focus on how the money is currently being spent, whether it's COVID-19 or whether it's women and girls. Is it being done in an accountable manner? And then the second thing I think we need to ask in the development space is impact. And it goes a little bit to your point, Suchi, of going to the community levels, to the actual recipients. We're not yet seeing that traction on the ground. And how do we really, I suppose, join the dots together to make sure that we reach this, or reach the women and girls?
Yeah. uh, we actually only have one question. So if there are any more questions, I would urge people to write in the Q&A pod, which is available, so that we can have the panelists. Actually, we're also on time, so I'm pretty excited. We I'm just thinking so much. We have so much going on right now globally, and with the campaign that we are running with My Body, My Mind, we're trying to bring everything together, make sense out of the realities of women, to remind people that there's hope, there's success stories, there are solutions, and to also remind that many is not yet solved, much of it is not yet solved. So and listening to all three of you today, bringing in your unique perspectives from your countries and from your regions and from your understanding, I am very excited about what hope is there in the coming time for. And I also want to send a lot of solidarity, strength to all the activists who are on our panel, who are all listening, who are participants to attending the webinar today, because it's it's needed. We need solidarity and strength to give to each other. There's a need for humanity right now, and there's a need for ensuring that we do the right steps. So any last words from all the three panelists? Do you want to say something to the amazing audience who has been listening and commenting in the chat pod? Anyone?
Yeah, I can go. Yeah, I just wanted to say thank you to all of you for organizing this panel and for having me along. But also thank you to everyone who tuned in. I mean, it's so great to, we have this like World YWCA and all the YWCA's movements. It's such a great global movement, like connecting so many activists. And it's great to see people from all corners of the world just tuning in and, sharing their perspectives. Because I think for, very good responses, we need to work together. We need to come up with those solutions together, and we can learn so much from each other. And it's fantastic that you are able to create that space and that platform when people are able to join in and share their knowledge and experiences and their stories. So it's been great. Thank you so much.
Thank you, Patricia. Actually, when you were talking, we had 3 questions come in. And I'm going to take a few of them, and maybe if because we are short of time, but there's one which exactly falls for Ronnie somehow. So Ronnie, there's a question which says, how can we involve young generation more? And because they are losing their excitement right now, they are troubled and they are not feeling mentally supported. So what do you think we should do to involve them more?
um, in this situation, first of all, we create a safe space for young people to young people for put their opinions, view what they want, and we also collect the सुझाव like के भन्छ त्यो collect the some success story and share with social media, and we also collect the suggestion for young people from them, and we also create a safe space for young people, and there we can share everything what they want, like if someone want sexual and reproductive health issues, then they can't, and if someone are want to listening, and they can, and we mostly we are mainly we have to listen young boys, and no judgmental, mainly some people are whatever background, and just give a safe space for young people, and there is creativity automatically come.
That is very well said. I mean, no judgment. And I've been reading how, and I've been listening to people telling that because of the lockdown, a lot of constriction is happening, and people are not able to share their opinions because they feel there is a fear of being judged, and there's a fear of getting attacked, and there's too much trolling on the digital space. So Ronnie, that's very beautifully put. Thank you. I will just look at one more question, and maybe we can leave the other one, and we can answer them on our social media. Um, so there's a question which says, I am in a country that has been very lucky in this situation. How can we benefit? How can we best support young women globally and share the benefits of that luck? So if someone wants to go for it, someone wants to answer, how can, so there's a question where they feel they are lucky about the during the pandemic, they feel lucky, and how can they support more young women if they want to support?
I can go for this one because I kind of feel like I'm in a similar situation, that obviously Scotland and the whole of UK has been affected by this, but we're still, we recognize our privilege and kind of having a lot of support from the government and policymakers, and a lot of structures kind of already in place to provide support for NGOs. So I think kind of my advice for that would be kind of listening to those stories and creating platforms for those stories. And there are so many kind of initiatives that you can join, whether it's like creating that space or whether it's supporting them financially. Like, everyone is in a different situation, but sometimes like just sharing what's happening, sharing it with people within your network. There might be someone who is able to help, and just providing it, I think. And I think Ronnie talked about it a lot, is just having that kind of safe space, that platform for diverse voices of young women to come through and to talk about how all of this affected them. And I think if you're in a fortunate situation to have that platform, sharing it with other young women who may not have it is a great way to kind of highlight those issues. And for me, always kind of recognizing your privilege, which clearly that person is doing, recognizing what you have and how you can share it, and how you can create a space for other people to have access to the benefits that you have. would be my take on that.
Thank you, Patricia. Yeah, I do feel that we know our privileges, and then we do the next step where we give, we share our privileges. Shakira, do you want to add anything on that? I mean, yeah.
Well, I mean, I'll probably open up a can of worms, but I will say we need to avoid elitist clubs of people, and our spaces tend to become elitist. And how do we make sure that we let other women in and we really truly bring other women in? I just, as I end off, Sushi, and if you'd allow me, I really wanted to appreciate YWCA's cartoon series and My Mind, My Body, or My Body, My Mind hashtag. And it was sort of like when I read it yesterday or was preparing yesterday, it was like a boom, bam moment, right? And there were just these nuggets that stuck with me. And I want us to end off a little bit with this, where the one cartoon says, my school expelled me when they found out I was pregnant. Real woman's story right there. The other one was breastfeeding is normal, let's normalize it. So it brings the question of how do we play a role in normalizing things. The other one was that it showed how it would take 257 years to achieve the gender pay gap or address the gender pay gap. And the final one is that rape is used as a tool or weapon of war. And I wanted to end up on this really real story that we're finding in refugee settings in Africa, where it touches a little bit on what Roni was talking about as well, where women who are refugees, in order to have their food packets, they are raped or they are taken advantage of. And so I really just wanted to end up on that reality, I suppose. But it's been brilliant to hang out with all of you, especially in these times when we're all webinared out, I guess.
Yes, and that the idea of this panel was to have brilliant people like you share your expertise in a more human way, in more realistic and practical way from the ground. And that's what the World YWC movement is all about. And I'm so thankful to all three of you and to all the amazing people who have been sharing such beautiful comments. I do want each of you to spend some time reading, because it's very inspiring. Everyone is sharing how they really like the panel. So I want to thank each listener, everyone, and thank you for commenting. Thank you for taking the time to spend an hour with us. Look forward to having you in the next one, which will be happening next month. And if you have any suggestions, any comments, please write to us at world office at worldwywca.org. We want to listen to the people. We want to change. We want to make sure that whatever we are doing is what is needed right now. So thank you so much all. Thank you all three of you. Amazing. Thank you my team who has been helping us with the technical side. And please write to us. And thank you, Patricia, Ronnie, and Shakira. Big cheer for you. Keep doing the great work that you guys are doing on field. Thank you.
Thank you so much.
Thank you, everyone. We'll close the session here now. Thank you.
Bye bye.
Bye bye.
Bye bye.